Hello everyone, it's Dr. Ryan coming to you with another video review of one of the Step 1 Free 120 questions. In this video, we'll take a look at Block 2, question number 6. So this question describes a 40-year-old woman who develops a runny nose, sneezing, and itchy eyes anytime she's exposed to cats. And then they tell you that the woman is desensitized by being administered increasing doses of the antigen. And what they want to know is which of the following is the most likely mechanism of the beneficial effect of this treatment. And they give us 5 answer choices. Okay, so this is a tough question because this is a topic that doesn't come up a lot when teaching first-year medical students. It's not something that's in first aid for the boards. It's not something we usually cover in basic immunology classes. The place where I learned this topic was when I did an allergy rotation as a medical resident. When you go to clinical practices with allergists, you will see this procedure done frequently for patients who have allergies. So what they're describing in this question is a process called desensitization. So when patients have allergic symptoms in response to a particular allergen, like cats in this example, what you can do is the patient goes to an allergist and the patient is administered small doses of the allergen that they are allergic to under the skin. And you do this over time, slowly increasing the dosages. And eventually the patient stops having such a severe allergic reaction to cats. And so what they want to know in this question is, what is the mechanism by which the desensitization procedure works? And like I said, this is something that I bet not a lot of medical students are going to know. And so the reason desensitization works is because of answer choice B here. What happens is when you administer increasing doses of the allergen to a patient, eventually that patient produces IgG antibodies. These are called blocking antibodies. They're going to circulate in the plasma. They're going to bind that antigen and prevent it from binding to IgE antibodies on mast cells, because when that happens, that's what produces the histamine response and the allergic symptoms. And so the immunology mechanism behind desensitization, which is the procedure this question is describing, is the production of IgG blocking antibodies. This is just something that you have to know. As to the wrong answer choices, another thing that makes this question hard is these other answer choices are plausible mechanisms by which you could limit an allergic response. They're just not the mechanism by which desensitization works. So answer choice A is formation of dimers that stimulate clearance by macrophage phagocytosis. This is not correct. This is describing the production of IgA antibodies, which are dimers. Those antibodies bind pathogens and other allergens and prevent them from getting into the body. And if that's how desensitization worked, this could be an effective mechanism. That's just not the right mechanism for the way the desensitization procedure works. Answer choice E is overwhelming IgE binding sites to result in inactivation of mast cells. This is not correct. If we overwhelmed IgE binding sites, we would produce a severe allergic reaction. That's why she's having the allergic reaction in the first place. And overwhelming those binding sites would not be beneficial, and that's not the way desensitization works. Answer choice D, production of anti-idiotypic antibody to IgE that results in its clearance. This is not correct. So anti-idiotypic antibodies are antibodies that bind other antibodies. So this answer choice is suggesting that the way this procedure might work is by producing antibodies that bind to IgG and cause it to be cleared from the body. That's just not how desensitization works. And then answer choice E is stimulation of macrophages to produce anti-inflammatory cytokines. Once again, this is a plausible mechanism for limiting someone's allergic symptoms. It's just not the way desensitization works. It works by producing IgG blocking antibodies. And that's answer choice B, something that you just sort of have to know. This is a relatively low yield fact. I don't recommend spending lots of time understanding how desensitization works, but it is good if you saw this question and got it wrong, and now you have this information in your mind in case you see one question like this on your STEP exam. And that concludes our video review of the Free 120 Block 2 question 6.